I'm Angelina Williams, and I'm the Chief Clinical Officer at the Guidance Center. But I'm also a mom, and I'm a neighbor to the communities that have experienced such devastation during these California fires. And my heart really goes out to those that have been affected and to the families that have lost their home, both in the physical and the emotional context of what it means to have a home, and to those that have been evacuated and everyone that's living with uncertainty. These events especially can be difficult for children, both those that have been directly impacted and those that are exposed to the images and the knowledge of these devastating events. So I just wanted to take a moment and talk about ways that you can have conversation with children and provide support. So first, we just want to remember that children take their emotional cues from adults. So it is so important to speak calmly and use a tone of compassion and patience, and let them know that they can ask you anything and that you're going to be there to listen. You want to sit at their eye level, and you want to be mindful of your physical proximity to them and ensure that they're comfortable with any physical touch that you might offer, like holding their hand or providing a hug. You want to use simple and age-appropriate language to explain and avoid unnecessary details. You might say that there are some fires in some areas, and there are so many people that are helping and providing support so that everyone is safe. And if you need to explain how far the fires are away from your child, use references they might understand, like the fires are like 2,000 car rides to grandma's house, or it's almost 3,000 football fields away. And you want to answer questions honestly and be ready for questions about their own safety. Let them know that you are responsible for keeping them safe and that you have a plan to keep them safe. Avoid exposure to the news coverage and social media, and be mindful of how you talk about the fires when they're present. And don't dismiss their emotions. It's so easy to say, don't worry about it. But it's normal for children to feel scared, to be worried, even to be worried to be away from you right now or have difficulty sleeping. You might even see themes in their play or in their art where they're drawing fires or themes of crisis and emergency. This is all normal during stressful times. There are a lot of different children's books that might address these themes, and I'll make sure that we include those in the link that's attached to this video. But if you're asking yourself, well, how do I know if my child needs more support? If their fears are so intense and they don't decrease over time, and you see changes in their normal interests and activities, their eating, their sleeping, or their mood has changed over an extended period of time, even after the stress, the stressors, and the crisis has abated, then yes, maybe it's time to seek some professional support, and the Guidance Center is here to support. And there are many other community mental health practitioners and mental health therapists and practitioners ready to help. So lastly, I just want you to know that you are doing an incredible job showing up for your child and taking the time to watch this video. So just remember to take care of yourself too. Be well. Bye.